their life in whatever little way. Let's acknowledge everybody who worked in Ungana. Thank you so much.
Good morning all, and I take it all protocol has been observed, so I don't have to go through that. And welcome to Dr. Nduku Kilonzo. I just want to make a couple of observations. One, for all the organizations sitting in this room, where you were, you started off with certain challenges that this program has actually managed to make you achieve and move forward. LVCT was in exactly a similar position, and they've actually had interventions and have moved forward. The question is, to all the organizations, how big can you grow? Have you considered that? And it may be a question that our guest speaker today considered when she started at LVCT so many years ago, as to how big she could grow. And she has actually grown quite big, and is now the director of the National AIDS Control Council. Mine, ladies and gentlemen, is very simple: to invite the director of the National AIDS Control Council, Dr. Nduku Kilonzo, to come and make her address. Thank you very much. Welcome.
Good morning, colleagues. The representative of the CDC, Director, Mary, Engineer Oba, Dr. Wanjiru. I'm really delighted to be here this morning. And first I have to say that I feel like I am sitting among friends. And as Engineer Bath was just making his introduction, I thought that was a bit of reversed roles, because I think normally I would be inviting him to speak. But having said that, I just want to reiterate what he said, which is really about what is capacity building. And that's what I would like to start talking about today, even before I really talk about where this is coming from and where it could go. And I think when I think about capacity building, I look at it as simply being able to develop the ability to execute. So whatever it is, it's just that, just the ability to execute. So if the ability is weak in a technical area, you develop it. If it's weak in an institutional area, you develop it. And often execution is driven by primarily people and the systems within which they work. So whenever we think about capacity building, those are the areas we are looking at. We are looking at people, and we are looking at the institutions, that's the systems that drive growth. So just starting from that point of view, I would really like to acknowledge the work that has been done by the sub-partners. I know all of you, and having been a part of the Ungana program, I'm really proud to be here today, to be able to see really a celebration of the work, a celebration of the results, a celebration of the outcome that Ungana has become over time. I would like to be able to thank the Board of LVCT, because they have supported the ideas that the organization has had to be able to grow. I would like to specifically and really thank CDC, because in many ways it is not very many development organizations that take the opportunity to support local organizations and believe that local organizations can actually drive technical assistance. And I do think that is something, and that is different. So thank you very much, Dr. Mary Mwangi. I would like to thank all of us who are here, the partners, and those who made it to where we are today. The journey was not always smooth. I know that along the way, there were times, there were challenges, there were times, there were differences. There were times there was even individual tensions. There were times when we all said, this is not working anymore, it's time to part ways. But it was the holding in and saying that we will still continue until the end that made the changes that we see today. But why do we need to build our capacities? Why is it that we are investing? We've had and we've seen the last booth had a huge amount of resources that have been invested in capacity building. It's because every time we think about where we want to go, it's determined by our ability to execute. But the question we need to ask ourselves is, where do we want to go? The National AIDS Control Council is tasked with giving us that direction, where we want to go. And currently, as a country, we are already looking at and developing our next steps. Where I see, or where we see ourselves going, is really a world with no new infections. Where we see ourselves going is a world where every person who is already HIV infected has the quality of life that they deserve, which is good and which is long. We also see ourselves in a world where stigma and discrimination do not exist. We see ourselves in a world where, as a country, we own the epidemic by being able to provide domestic resources, whether they are from the national government or from the county governments. So why is this important? It's important. Why is capacity building important? It is important because to get there, we need people that have the ability to execute what is required. And it is important because we need institutions that have the capacity to execute what is required, whether those are individual people, whether the institutions are state or government institutions, or whether the institutions are private sector institutions. And that is the place of NAC. A place of NAC is to bring together different institutions. The place of NAC is to be able to actually deliver what is called a multi-sectoral response. And sometimes that sounds like a cliche that may not make much of a difference, but it is the ability to ask ourselves, who else needs to be around this table? Who else should we be talking to? And that really became poignant for me when we were going around the booths. If you look at the booths, there were people who are saying, we're doing a little bit of agriculture because it is important. We are doing entrepreneurship and trade because it is important to respond to HIV. There were programs that were looking at saying, well, actually, we are working with young people, and that means we have to engage the Ministry of Education. That is what a multi-sectoral response is. And today, for me, it's a celebration of being able to show how working with different sectors can achieve different things. Local capacity building becomes even more important in the context of counties for various reasons. We are all aware that budgets and resources are required to be able to deliver the HIV response. A huge part of that response is vested in counties by the functions that are given to them within the Constitution, which then means that we need to be able to support counties, be able to deliver. How do we do that? There are various ways. One is to provide technical assistance that is required. We need to develop methodologies through which we can support counties to ensure that they have HIV plans that are integrated into their county integrated development plans. We need to be able to provide counties with technical assistance for costing and financing so that from their budgets they can appropriately give the resources that are required for each specific county based on its different needs for the HIV response. But importantly, for these things to happen and for there to be accountability, we need to be able to give the non-state actors, that is the civil society organizations, the capacity to advocate. What I know is that advocacy has been a capacity that has been vested at the national level in many of the NGOs. This is really for us who are here today, who are organizations that most of us are working at local level, and in many ways we are working directly with our counties. This is a call and a challenge to you. How do we ensure that we build our capacity to provide not only technical assistance, but the advocacy that is required to be able to deliver on counties being able and support counties, but not only support them, but also strengthen accountability. Importantly is a question about how local organizations can increase their efficiency and reduce their operational costs. As we are all aware, resources are dwindling. And in the dwindling resources, it means that we have to do more for less money. I think we have heard that a lot of times. What does that actually mean in terms of our ability to execute, i.e. our capacities? We need to be thinking about capacity building in the context of working with other agencies and other sectors. We need to be able to engage and support the education sectors, the labor and social security who are responsible for orphans and vulnerable children and youth, and agriculture and transport sectors, so that they are able to integrate HIV and deliver HIV targets. We expect to be able to see this within the AIDS strategic framework, but it is not going to happen if there isn't sufficient local capacity. Importantly, for that to happen, we need to be able to deliver on the quality of care. We have seen a huge program on provider-initiated testing and counseling that was supported through the Ungana project. And this really is one of those programs that was supported and engaged and engineered through public sector. How do we ensure that the gains made continue and that they continue to be taken care of, that they continue to be resourced, and that there is continued accountability, because that is the function of counties and that is our role. So therefore, capacity building is not only about us getting our capacity built. It is about us taking the lessons that we have learned and utilizing them to build the capacity of others. As I conclude, I would like to just say that Ungana demonstrates that peer-to-peer approaches can work. It demonstrates that you can learn. And I like what it is that was said, I think earlier on this podium, the question of LVCT taking what they learned through the gaps, through the challenges, and being able to grow into a big organization. The question is, can you do the same for the county levels that you work? Can you take the methodologies that you have learned? Can you take the strategies that you have learned? Can you develop peer-to-peer approaches for other local organizations, but also to support county governments to be able to deliver? That is what I leave you. And importantly, I want to congratulate Ungana for the good work, because it also demonstrates that a south-to-south technical assistance model is possible and it can be done. And I dare say that it is also cost-effective in the sense that you have local organizations who have less resource implications being able to build the capacity of other local organizations. I would like to be able to say that as far as capacity building is concerned, we need to continue to invest so that we can continue to develop the mass of providers, or the critical mass of providers of health services that are urgently required right now, as we very well know. In conclusion, the important thing is also what we are measuring. When we think about capacity building, we must start to think about measuring the outcomes that we have, not only in the numbers of people who have received services, but in the bigger outcomes of the bigger picture. How many infections did we prevent? How many of those who are already HIV positive suppress their virus? What is the coverage that we have achieved by county, by sub-county? And we have to be accountable as teams and as groups of non-state actors to our counties. I would like to finalize by congratulating LVCT partners. I would like to challenge all the partners here to be able to take on capacity building. And I would also like to say to CDC, capacity building is required now more than ever. Even in the context of right sizing, it is important to be able to invest in the people that will carry along the gains that have been made so far. This is one of the things that are important to continue investing in. Thank you very much, everybody.
So just to say thank you, and really to say that I would not have missed this grand opportunity to see or to celebrate really the successes, because I don't call this close out, to celebrate the successes of Ungana and of capacity building for local organizations. Asanteni sana.
As we gather to celebrate the accomplishments of the Ungana project and think about how to sustain capacity development at the local level, it's important to think about the continuum of capacity development and capacity building in Eastern and Southern Africa. And so Catherine asked me to come and talk a little bit about the regional context of capacity building as it affects local, national, and global capacity development. So I'll be talking a little bit about the need for a focus on regional capacity building in Eastern and Southern Africa. I'll talk about the current context of HIV/AIDS capacity building, both some of the challenges that we face and also some of the progress that's been made. And then we'll highlight some of the opportunities to strengthen regional HIV and AIDS capacity building. But first I want to give you a little bit of background about the Africa Capacity Alliance, which is a network organization currently consisting of 37 member institutions across 12 countries in Eastern and Southern Africa. We were founded over 15 years ago as the Regional AIDS Training Network. Many of you may be familiar with RATN. And we were founded to address the lack at the time, the utter lack of HIV/AIDS training opportunities for healthcare workers. Along the way, as the HIV/AIDS pandemic has matured and information has become more readily available, training has become more common, we have evolved to address broader issues of capacity building and also broader issues of health. And in early this year, in 2014, we rebranded to Africa Capacity Alliance, or ACA. And our focus is expanded beyond just HIV and AIDS, although that is still a major component of what we do, to broader issues of health, including significant and infectious diseases, non-communicable diseases, and health equity and rights. And the primary ways in which we build capacity for health are through institutional strengthening programs, much like Ungana, training, information sharing, and also advocacy. This is a snapshot of some of our members. I apologize that it's so small, but the way that we accomplish our work is actually through our network of member organizations. LVCT Health happens to be one, and these are organizations that have various expertise as it relates to capacity building for HIV and AIDS and other issues in health. And it's through these organizations that we both support capacity development, but also gather what they've learned to share across the region. One way in which ACA supports capacity development in the region is through a program called the HIV Capacity Building Partners Forum. This is an ACA-led consortium which includes many of our member institutions, but also civil society members, local governments, regional coordinating bodies, that was brought together to build consensus on where we stand in terms of HIV and AIDS capacity building, what the needs are, to share best practices and knowledge from across the region, and also to advocate for inclusion of capacity development in national health policies and budgets. And so it's a biannual summit. The last one was held in 2013, and the next one will be next year in 2015. And in between summits, we convene various technical working groups to drill down on specific issues related to capacity building and to carry the agenda forward. And I've put the website here, www.hivcapacityforum.org. This is a site that you can all go to find lots of resources related to capacity building. There are case studies from organizations across the region, and it's a rich resource, and we'd also encourage you to put your resources there as well. So one of the things that was a component of the last Capacity Summit was a comprehensive regional scan of not only the donor landscape, but also the capacity building landscape to determine, what are the opportunities going forward? What are the challenges that we need to address? And so what I'm going to be talking about next are the findings sort of from the Capacity Building Forum. And they provide just the regional context in terms of what needs to be done relative to HIV/AIDS capacity building. So first, the need for regional focus. There's many reasons that we should focus on regional capacity building at the same time that we're talking about national and local capacity building. The first of which is cross-border health response. And the most obvious example right this minute that the whole world is looking at is Ebola. As we watch the spread of the disease across borders, and we see an utter lack of capacity to deal with this rapidly spreading disease. When it comes to HIV, specifically when we talk about cross-border health response, as you all know, movement of key populations is a very important component of HIV response. And so regional capacity building to be able to manage those populations that move back and forth is an extremely important reason to focus on capacity building. Also, knowledge sharing. There's a lot of talk about South-South learning and finding case studies and other lessons learned from organizations that are in the same region that we are, that share the same or many of the same features in terms of their disease, but also in their response or in their infrastructure. So being able to collaborate on a regional level is something that is extremely important in making sure that our national response is even stronger based on good lessons learned. Then there's the issue of economies of scale. So obviously when you're trying to tackle a problem that stretches across borders and around the region, the more that you can pool your resources and be able to collaborate with other partners, the more impactful you'll be and the less resources you'll have to put towards that. And then finally, accountability is another key reason to focus on regional capacity building. When you're collaborating with other countries, other members of your community, it keeps you, and you build together the framework for capacity building, it keeps everyone accountable in terms of the progress that they're making and being able to sort of gauge how others in the region are progressing. And at the end of the day, then we make sure that we keep a sustained focus on capacity building. So some of the challenges that we see on the regional landscape, and many of these will be the same as the national landscape. I don't know what Daraus is going to tell us, but I think you'll see a lot of similar themes. The first one is actually, it's a challenge, but also an opportunity, the integration of health. The maturing HIV and AIDS pandemic means that resources in the coming years are going to be increasingly focused on integrated issues, including sexual, reproductive, and maternal and child health, malaria and tuberculosis, health system strengthening. We're already seeing this, but that means that at a regional level, we need to be thinking about how do we continue to build capacity for HIV and AIDS response while taking into consideration these other issues that we need to address. Another challenge is the increased emphasis on measurement and value for money. Again, an opportunity, it's something that we should all be thinking about, but it means that one of the issues that's historically plagues capacity building is the ability to effectively measure your progress, and especially in the short term, because often capacity building is not something that just happens overnight. You have to invest resources, you have to wait, to see the progress. As many of you who've been involved in this project for the past 5 years, I was saying to Catherine earlier this morning as we were going around the exhibits that now, 5 years later, when you see the accomplishments, it's very obvious what the capacity building has achieved, but along the way, it takes time to gather those results. So increased emphasis on being able to measure and also being able to show that value for money from donors is something that is also sometimes a challenge that we need to work on. Another challenge is project-specific capacity building versus institutional strengthening. We see a lot of programs that are built with a component of capacity building, but it's very specific to that particular intervention or that particular project, and it doesn't always have a shelf life beyond the life of the project. I'm really encouraged that we're having this kind of a meeting to talk about how Ungana can carry the work that it's done forward, and those are the kinds of challenges that we also need to be able to address. Dependence in the region on external resources for health budgets often takes support away from capacity building initiatives, because when you have governments that are not fully in control of the resources that they're putting towards the health response, they're not always able to prioritize capacity building maybe in the way that they should. And then finally, another challenge is the limited participation of civil society in priority setting. So here we're talking about the formation of national strategic plans, regional responses. It's difficult often for grassroots organizations for their voices to be heard at the level at which these plans are being made. And so being able to capacitate and